Music talk. All right, so um, a little bit. Well, I don't know. I want to hear from you too. Like, why are you guys in community org? What do you want to do?
I kind of got introduced to social work from like a more macro
Okay.
side of things. And I've always really just been interested in that. I got my undergraduate in social work, so I'm advanced standing. But
Okay.
the program, I did my undergraduate program at Southeast Missouri State.
Okay, Simo. Yeah.
Yeah. And that one is a very like micro focused, like rural social work
Hmm.
practice, which was very interesting. But I'm definitely very excited to learn more macro and also like more up here focused.
So when you say micro down there, do you mean more like clinical or
Yeah, things tend to be a bit more clinical and a bit more of just like intense case management. It's kind of like the only thing I was really seeing
yeah,
down there, just because that's what everyone needs to do the most.
right.
And there's just a lack of resources down there a lot, lack of transportation.
Right. Yeah. That's true. Like the inability of, I mean, because of the lack of resources, like there's just not going to be much available to social workers to connect people with, right? Yeah, so I could see where that would, by its nature, be very focused on sort of more clinical. So,
Yeah.
hi,
But I was
Danny.
kind of more interested in that macro side.
Right.
So that's
Yeah.
why the community organization.
Gotcha. Well, great. Okay. Well, you're gonna, yeah, it's gonna be, anecdotally anyways, it's been a lot of like, for me, most of the students are from St. Louis or maybe a bigger urban area. And so for you to come here and bring that perspective is going to be really, really important. So, hopefully you're one of these students that talks up in class a lot because I think you got a lot to offer.
Thank you.
Well, great to have you, Jessica. Samantha, what about you?
Yeah, so first off, like I really love my current job at SLU managing our volunteer tour guides, and I really like,
That's good to get on record on the Zoom
yeah.
recording in case Big Slew is listening,
No,
right?
no, no,
Yeah, I
like
love my job. That's good.
so my background is in psychology. Like that's what my degree is in. And right after I graduated, I kind of realized I didn't want to go into working in mental health or anything.
Hmm.
So like my pre-COVID background was working in entertainment marketing.
Oh, wow.
So yeah, I was working in like hotels and resorts and with a couple like luxury brands. And yeah, so that was like really great. But nobody really needed that during COVID. So I changed to working in higher education. And I really love that kind of impact that I've been able to have on the students I work with. Um, so I really want to work with like young people, specifically more in like an arts and music setting,
Hmm.
and like nonprofit work with that. So like I've seen a couple like community art centers that I think would really be cool to work in like a social work capacity in those.
Yeah. Well, one of our graduate, well, she was a PhD student with us, but she does work with like Channel 9 and PBS, doing like outreach sort of stuff. That seems really, really interesting and creative. And um, yeah, with your background in entertainment and sort of that sort of world, like you're gonna have some hard skills that are going to be very marketable when it comes to other nonprofits. So,
Yeah,
um,
I do a lot of writing for my jobs that I've had,
hmm,
and everyone needs a grant writer. Everyone needs to make someone to make a website. Um, there's a lot of work that I do that kind of directly translates to the kind of like administrative work that comes with social work.
yeah, that's great. Well, you guys both seem like you picked the right concentration. So, and honestly, the sort of the and I not that we keep this from the clinical students, but eventually they're going to have to learn these skills too, because typically people don't. You want to sort of move up in your career, right? So if you look at sort of the life cycle of a social work career, I think you'd be hard pressed to find people who didn't eventually get into administration or in some sort of nonprofit sort of community role, right? Even if they have a clinical background. So you guys are just kind of getting a head start. But I'm a little biased when it comes to this, since I'm the chair, of course. But if you look at the history of social work, the all the way back to the Mary Richmonds and the Jane Addams start here in the United States, that really what they were doing is community and organizing type of social work. So there was a book that came out, gosh, this is probably late 90s now, a long time ago. But if you guys ever want to read a little bit up on it, it's called Unfaithful Angels. And it was basically how the field of social work is moving away from sort of this community-based type of social work practice and being much more concentrated on clinical, which absolutely has a huge role in what social work does, but has really sort of created sort of this different identity. What they are arguing was this sort of different identity for social work. So so that's sort of my view of what the community and org concentration is, but sort of run through these slides with you all. But this is who I am. So I think it's important to know that I don't have an MSW, like I've never actually done social work. I have a PhD and I have a master's in sociology, so I'm basically a researcher. So I don't teach any practice courses. They make me teach, or they let me teach, not make me, they let me teach policy and research, and I teach like statistics for the PhD students. I teach one of these Ignite seminars called The Science of Helping. Jessica, these Ignite seminars are sort of what incoming freshmen, like the first class that they take, one of the first classes that they take, and it's supposed to be sort of to, ignite is a little bit of a pun, like it's supposed to ignite their curiosity. And professors are supposed to, like, I just sort of made up the class. I can do whatever I want, and I change it every year because I get bored. But you're supposed to sort of do it on this class on like your research and your passion. Problem is, my passion is child abuse and neglect, and so I don't want to hit these like 17-year-olds coming out of high school with that. So call it The Science of Helping, and I kind of take a little bit of try to gauge sort of the kids or the students to see how much we can do. This year they were very open to really learning about trauma, so we did a lot of stuff around trauma, but in the past we've talked more about poverty, sort of the way the body responds to trauma, things like that. But my area is child abuse and neglect, food insecurity in particular, and kids with disabilities. Like that's sort of my two tracks. So most of my time is spent doing research with PhD students, and most of what I do is secondary data of stuff that's already been collected by the CDC or Department of Health and Human Services. Although I do have this small little program that I'm starting up where we're basically DoorDash, or what I call reverse Meals on Wheels. So we partner with Crisis Nursery here and Lutherans Family and Children's Services to identify families who are very food insecure and on the cusp of foster care entry. So these are, they've been investigated several times. It's probably going to happen. They're probably going to get their kids taken away. And what we do is we swoop in with food. So we partner with a commercial kitchen. I get these volunteers to sort of pick the food up and drive it to the home. So we deliver ready to heat or ready to eat lunch and dinner every day for like a couple months to sort of stabilize these families. So we try to prevent foster care entry through basically eradicating food insecurity. Not just that, but then providing like an abundance of food. And like really good quality food too. These are like freshly baked breads, they're desserts, they get everything. And so I do some of that work. I also have this little bit of program where I'm training law enforcement around mental health in the state of Illinois. So those are just a few of the things that I do. And those are the classes that I teach. So yeah, and I guess before I came here, I worked at in in partnership with the Department of Children and Family Services at the University of Illinois and with the ACLU when we monitored the health and welfare of kids in foster care for the state of Illinois. So it was a lot of policy work around that, but in particular around research. Starting new initiatives, new policies and procedures. Our job was to then sort of evaluate them to see if they were working or not, and then make recommendations to the director of DCFS and this one lawyer at the ACLU who made these sort of decisions. So that's sort of where I come from in terms of policy. It's a little bit different. I've never been boots on the ground or anything, but I've done sort of the big picture research on it. So community org is what you guys described it as, meso and macro practice. So we're really focused more on systems and environments than we are on necessarily on individual problems, how environments shape rights, resources, and behaviors, and how we can change things sort of on the larger levels. And our program tries to emphasize leadership a lot. We want to get you ready to sort of be those administrators at nonprofits or at hospitals or all the other places that social workers are in the community. We're trying to change communities through organizations. That's kind of how one of our professors puts it, and I kind of like it in that way. So these are the kind of questions that you're going to be answering or trying to answer. These are the questions that should get you excited compared to someone that's more of a clinical track. How can communities get organized to press for more resources or social justice from decision makers? Jessica, down in the Boot Hill or down in, really rural parts of different states, how do you get more resources coming into the area? I've talked to people who run hunger programs, food insecurity programs in those areas, and the concerns there and the lack of resources and the strategies are totally different, right? You don't have a density of population like you do here in St. Louis. You're trying to get to people who have a lack of transportation in a huge county or 4 or 5 different counties put together. So those questions look different in different places. What can organizations do to facilitate client empowerment? How can we change the environment to make it easier for families to be healthier? How can we change the process to promote civic engagement of people in the local community? I don't know how much you saw of that in like the Boot Hill, but like trying to get people more involved in their own community and to sort of help with like shared decision-making processes and things like that is another big part of social work. One of our professors here, who you may have, Dr. Sabrina Tayus, all she does is voter registration, right? Like that's her main focus. That is her social work field. And you could make the argument that that's what we should all be doing. If we're really, one of the things we're trying to do is to change environments and add more resources to people and access to resources and healthcare and things like that. A lot of that work gets done through the political process. So how can organizations raise enough funds? We have some students that come through here and then go directly to become a full-time development person at a nonprofit. I've had a couple of those students. Worked with an organization in St. Louis called L'Arche, which is Homes for Adults with Developmental Disabilities. So after, you graduate, and next week you're planning fundraising events and trying to figure out how to raise money, both through grants and through private donors. And then how do we effectively advocate for change laws to make it easier for people to vote? That's the Sabrina question down there. So these are the things that should get you two excited more than it should get other students excited. So are you energized? What it makes the concentration exciting for students? Are you energized by the idea of making change to the environment? Interested in broad social change such as racial justice, or smaller change within communities such as affecting the supply of affordable housing? Interested in starting or running a program, a nonprofit, serving as an administrator? You guys will be much more equipped to go out and start your own nonprofit and have the knowledge and maybe even skills to do that. And do you enjoy organizing and facilitating events, community processing, making sure everything is working smoothly, all the things that a good administrator does? So this will prepare you to be a community organizer, a program developer, administrator, a policy practitioner. a grant writer, fundraiser, or even a program evaluator. There's actually the last two are very specific skills and are probably the least exciting out of all those, right? But if you develop those skills and you're good at it and you like it, that's where you can make a big difference in the lives of people through organizations, and also those are highly sought after skills that organizations will pay a good price for. So one of the things we want you to know, one of the things that I always tell my mentors or mentees is that, yep, we're all in it to help people, but you got to make your money, and I want you to make as much money as possible. So those last two jobs are ones that can be you're not going to make more than like a living wage, right? But a little bit higher of a living wage, maybe. In my experience, anyways. So any questions about any of that so far? Sounds like what you signed up for. All right, it's good. Missing anything? No? All right. So here's the logistics of it. You're going to take two classes that are specific to the concentration, and then a bunch of electives, and then your practicum is always the most important thing in any social work master's program. So so Jessica, you're coming in with a BSSW, so you probably don't need to take foundation, but you'll take two concentration practicums, and Samantha, I'm guessing you'll take all three. Yeah. So the two courses that you take with other students in the concentration, although there could be some clinical students peppered in there too, is Community Theory and Practice with Dr. Birkenmeyer, or Organization and Program Planning with Dr. McMillan. So these are just kind of our hallmark courses, our concentration courses. Community Theory and Practice is more about sort of more theoretical, about community change models and sort of how those theories work and how to apply it to specific examples. I was reading over the syllabus before we came in. Julie has a couple of ways that you can sort of apply it, and one's more of a policy analysis sort of way, and one is actually embedding yourself into some sort of community change that's going on, either in St. Louis or somewhere else. So that's kind of exciting. And then Steve's class is more about the nuts and bolts of how to run an organization and a nonprofit. So those are the two sort of classes that are specific to the concentration. Then there's a bunch of different electives, and those change from semester to semester. And those you don't have to take, and you don't have to find the most, community org sounding ones of those. You can kind of piece those together however you want, whatever makes sense for you. Yeah, so that's, it's kind of simple. There's not much to the concentration part of the classes. Here's some examples of some electives. Introduction to Nonprofit Management, Financial Capability and Asset Building Practices. That one's offered all the time. Julie does a lot of work in communities around fair banking practices and sort of saving, sort of education and things like that. One of her goals is to get rid of these evil check into cash title loan places that really take advantage of people in communities. Social entrepreneurship, practice and global issues. Although that one was offered this semester and didn't make, there wasn't enough students to go into that one. And then practice with families and communities experiencing poverty. Those are just some of them, but again, they kind of change from semester to semester. And then for your practicum, the general areas are going to be more nonprofit administration, policy advocacy, community organizing, those kinds of places. Some examples of this would be community-based coalitions and task force or advocacy campaigns, agency administration, so grant writing, supervision, working with boards of directors. That basically explains what a development person does. attending governmental meetings, those kinds of things. Um, we have had people do practicums in different places, not just St. Louis, depending on the situation. So especially now that we're have like sort of fully online program, it's a lot more open to those kinds of things. Um, and then I think the next slide has like very specific examples of places around here. So like a policy advocacy example would be like Missouri Budget Project or Legal Services of Eastern Missouri. Um, you know, Nonprofit administration, Incarnate Word Foundation. We've had students be really successful there. They're kind of they provide grants for sort of smaller nonprofits around the area. Lutheran Family and Children Services, um, Housing Everyone, STL, Healing Actions, Arch City Defenders do great legal work. So there's some of those examples. And then community practice, Youth Family Center is like an old school settlement house. St. Louis County Children's Fund and Mental Health Board do more like funding of agencies. So those are just some of the examples around here. So, um, and then of course there's like several others, and new ones come up fairly frequently. So you'll meet with your practicum liaison, or practicum advisor, I guess, and sort of can go over that. I'm guessing Wendy kind of talked about like how that works earlier. Did you guys get like a practicum sort of? Yeah. Um, so most students are very happy with where they go. Like it's a much better process than other universities where it's kind of on you guys to find something. Here we do a really good job around St. Louis with WashU and UMSL of sort of sharing and having this big database and really finding the best fit. So that's it in terms of my presentation. I'm on the third floor here. If you guys ever need to find me, I'm around fairly often. But what questions do you have? You've been in this for like 4 hours already today. So, is there something that, and it doesn't even have to be about ComOrg. If you got other questions about the program, I'm happy to try and answer those.
I don't think I've got anything right now. I know it's been a lot of information for the last 4 hours today, so
Yeah.
The one thing I was wondering is if it's possible to do practicum during the summertime or if it has to be during a fall or spring semester.
Nope. You can do it over the summer. It's
Okay.
more concentrated. It's like 300 hours or something, and you just have to get that in within the summer. So it's like more of a full-time job than a part-time job over the summer, but students absolutely do that.
Cool.
The practicum, the big thing is just starting early. So, you know, not not starting in May thinking that like you're going to be able to start in June, right? Like start early in the semester before you're going to go into practicum. Like get with your advisor will like email you, like all this will be sent to you, but make sure you meet with them early, and then you should have no problems.
Perfect.
And I'm happy to like, if you guys want to bounce ideas off of me or something, use me as a resource or talk to other people. If you get to know other students, like ask who's been in that practicum and talk to them and see what they think. The other thing I say about practicum to some of my mentees is that you might have an idea of what you want to do, but don't be afraid to kind of branch out and try something different. Particularly you, Samantha, with your foundation practicum. Like if you never thought you're going to do like hospital work, like try and find one at a hospital and just see if you like it, right?
Yeah.
Social work, I don't know what the research shows these days, but it's a pretty high burnout rate in terms of jobs, and so you're not going to work in the same sector of social work your whole career. So you might work in schools for 10 years and then want something different. So, if you want to start that process now of kind of figuring out sort of more of a breadth of what's out there, you can kind of do it with the foundation practicum.
Yeah. I don't really expect there's anything that's going to be like as niche as I want it. So,
What would you think? Talk more about that. Like, what does that mean? Like
oh,
in
I
terms
was
of,
kind of scrolling through some of the ones that were open, and it kind of seemed like most of them were like schools and hospitals and stuff.
yeah,
There was one like Arts Foundation that I was seeing that seemed like directly relevant, but I kind of expected that, there was going to be a larger population for like the medical stuff and the school stuff because that's kind of just, the sample size.
right. With you, I mean, one easy thing that comes up to mind that wouldn't jump out as saying like, arts or anything would be like a settlement house or some sort of program that has like an after
Mhm.
school program that you could actually
Yeah.
pitch an idea to. I've had students who one student in particular worked with a group, and her whole thing was midnight basketball, bringing back midnight basketball to like a couple of neighborhoods in North St. Louis, and that's what she did for like an entire semester. Worked with an organization to do that. So
Yeah, I would say like the overarching interest I have kind of generally is like third spaces and the overall like, crime reduction and also mental health outcome improvements that you see for kids who have places to just go not have to spend money and just be able to exist without like adults bothering them, but in a safe environment that's like structured.
right,
Um, yeah.
yeah, I think the it'll take a little bit more time for you to sort of find that, but I think talking to particularly Dr. Ducasse, talking to Wendy, like she's been around for a while and knows all these places. Like she'll be able to fit you somewhere that would kind of be specific to that interest, I think.
Yeah.
All right. Well, I'm not supposed to let you leave early, so we have to sit here for 6 minutes and stare. I'm just joking. It's nice to meet you. Um, yeah, I'd love to be as much of a resource to you as you want me to be. So, there's some students I meet with all the time, and there's some students I never really hear from. So, I'm open to both of those. So if you want to just jump on a Zoom call with me for any sort of questions, please let me know. Or if you want to come, just find me. So I'm typically here most of the week, and you would only be interrupting me like writing something. So I don't mind being interrupted. So show up unannounced or make an appointment. Either way is fine with me.
Are you
But
teaching the 5707 class? This?
no,
No?
no,
Okay.
that's Steve. If you're doing it in person, yeah, um, yeah. Although I've taught it, I've
Yeah.
taught it
It was
several
on your
times.
list of classes that you sometimes taught, so I was wondering.
Oh, okay. Yeah, I'm teaching the 5702, the policy class that Samantha will have to take, but you don't have to take. The online course, but that one's like asynchronous, so other than sort of hearing my voice over lectures, and with that class, I tell students, if you don't bother me, I won't bother you. Like, we like to, like our asynchronous classes, like, should be really asynchronous.
Hmm.
Um, and it's always kind of a hard line trying to allow students to interact with each other and sort of build community and seem heard, but also like be able to do it on their own time. So um, yeah, 5707. One bit of advice for both of you for 5707. It hinges on the logic model. So if you don't know what a logic model is right now, read up on it. I mean, you're going to get it in the class too, but usually that's the light bulb moment for students in that class. It's like, oh, everything builds towards the logic model, which is in like week 10, and then everything from there, from week 10 to week 15, is based on the logic model. And the logic model is about policy change. So it's like your typical logic model with like inputs and outputs and outcomes, but it's all about sort of like how you could move a policy through like the Missouri State House in Jeff City. So it's one of our more difficult classes. It's a lot of work, but it's students are so much better for it at the end. It's rigorous, and you get your money's worth. That's for sure. But logic model, logic model, logic model. So, and then yeah. And if you have any other questions about that class, email me. I'm happy to talk about it.
Okay, thank you.
I'm also very happy not teaching it. So, but I'm
Sounds
happy
like
to
an
talk.
intense class. I'm a little worried, but I think I'll be okay.
Yeah, you got to keep up.
Okay.
So if if you get behind 1 week, it snowballs because everything, it's like a lab class in science. Like everything builds off of everything. So, yeah. All right. See you guys later. See you around campus. Good luck. Let me
Thank
know if you
you.
have any questions.
Okay.
Bye.